My name's Elaine Day and I'm Service Improvement and Development Manager for the Cardiac and Stroke Networks in Lancashire and Cumbria. And I've had the pleasure of working on this telestroke project over the last couple of years. Our area is Cumbria and Lancashire and it has a population of 2.2 million. We have approximately 4,000 to 4,500 strokes a year, and out of that 10% of those patients would be eligible for stroke thrombolysis. Stroke thrombolysis is the drug of treatment for patients who've had a blood clot, not a blood hemorrhage type stroke. It needs to begin within 4.5 hours of onset, and within that 4.5 hours they have to reach hospital, they have to have an assessment, they have to have a CT scan, and then thrombolysis given if it's appropriate.
Because of the geography in Cumbria and Lancashire, we have a big rural population, and because of the travel times involved, the only way that we could provide a meaningful, equitable 24-hour service across our geography was to look at either a local provision or a telestroke solution.
And we thought that we would quite like to go with the multi-sense Polycom kit.
I think the main advantage of using the Polycom cart is that we've really enhanced the quality of stroke care for the patients in the Cumbria and Lancashire network. I will dial into the remote telecart, and that's simply by the press of a button on my PC at home. I can then video conference and have picture within picture. I can then see the patient at the far end and the staff at the far end. I can remotely control the distant camera so that I can pan and zoom to very high quality, so that I can even zoom in and see the state of or the size of people's pupils. And then I can do a neurological assessment of the patient and then make a diagnosis and a judgment about whether they should be treated or not.
It's because it's so essential that once the consultant on the shift here goes home, obviously then they're in the hands of the telecart, if you like. It's absolutely an amazing piece of equipment in the fact that it does, they can determine the diagnosis from that picture, from whatever distance that might be within the northwest of the area.
For a really quite small financial outlay, they've got a 24-hour consultant-led service for their stroke patients.
It's an absolutely fantastic piece of equipment.